Hello, my name is Maartje and today I'll be showing you how to do a Prontogest injection. Apart from this video, it's also important for you to come into the clinic for a demonstration in person. So the Prontogest comes in a vial with oil, and one box has 3 vials. First of all, we need to remove the neck of the vial here, and there might be a little bit of medication in the top, so give it a little flick and that will come down. I'm going to be using a snapper to remove the neck of the vial, but you could also use your hands if you want. There are little teeth here that you can just put over the vial like this, and then I'm going to use my thumb on the bottom, my thumb here, and I'll snap this off. The glass will be safely in the plastic snapper, which can go into your shops box. Now I'm going to prepare my syringe and the needle that I'll draw this up with. I'm going to be using a green needle to draw the oil up in the syringe. Make sure that you don't touch the top of the syringe. Just press this on like this and take your hands away from each other to remove the cap. Okay, I'm going to draw all the medication up in the syringe now by putting the corner of the needle in the edge of the vial here and draw everything up in the syringe. Do not worry if there's a little bit of air as well, we remove that later. Once everything is in here, I'm going to remove the vial into the shops box, and now I am going to change the needle. Please note that you might use a green needle for injection. To safely change the needle, scoop this up from the table so you don't have to touch this. You can twist this off like so. Press this on, take off the cap, and now I'm just going to press the plunger up until I see a tiny drop of the oil come out of the needle, so I know this is completely primed. You will find when you do this, this is quite a viscous oil. It's a bit harder to press up than when you are doing your injection, so just take your time with this. I'm just going to put the cap back on before I show you where to inject. It's important to know that this injection is done in the muscle, so we need to make sure that the needle reaches the muscle when we inject. Now, we would recommend this to be done in the outer quadrant of the buttocks, and a way to know where to inject is putting your hand on the hip bone and pull your hand away and make an imaginary cross like this. We're using the outer quadrant of the buttocks to inject. The injection site is just here in the right corner. If you're not quite sure, we can help you when you come into the clinic to show you where the injection needs to go. Now, I remove the cap of the needle, and then it's very important that you inject straight in. The needle has to go all the way in. Once the needle is all the way in, we have to pull the plunger back to aspirate to ensure there is no blood in the syringe. If there's any blood in the syringe, you have to remove the syringe completely and prepare a new one. Once you see that there's a tiny air bubble but no blood, we're going to be injecting the oil into the skin. Once the plunger is all the way down, you take out the needle in a rapid movement and use a cotton ball to press down on the injection site. Because it's an oil, it takes a bit longer to break down, so it's important for you to gently massage the area or go for a walk to help the absorption. A few tips when you're doing Prontogest injections. We know it's not a very easy injection to do, so please come to us with any questions or concerns. A few things that might help you. You can warm up the vial by putting in your hand for a minute or two to kind of help it warm up a bit more. Some patients also find that using a bit of ice on your buttocks to kind of numb the area can help. Now, once you've done the injection, you can massage the area gently to help absorption, or I would recommend going for a walk afterwards, which kind of breaks down the oil a bit easier in your muscle.